Hello everyone. Today we will be discussing about vertigo. So, what is vertigo? Vertigo, which is also known as giddiness, is a disturbance of sense of equilibrium and movements. Over here, the person feels that either the surroundings are revolving around him or he himself is rotating. Talking about the severity of vertigo, it may range from the sense of mild giddiness to a severe vertigo with nausea and vomiting. Talking about the physiology of equilibrium. Equilibrium is primarily maintained by the vestibular part of the labyrinth. It is added by the eyes and the proprioceptive senses distributed all over the body. However, the final controlling of the equilibrium is done by the cerebellum and the cerebrum, which are connected to each other. Though the main end organ of equilibrium is the labyrinth, vertigo itself is a cortical phenomena. Moving ahead with the causes of vertigo, the major causes can be grouped into four different categories, that is causes in the ear, causes outside the ear, non-infective causes and functional causes. So, causes in the ear involve three major components, that is in the external ear, middle ear and inner ear. External ear may involve wax. Middle ear infections like otitis media may act as a cause, and inner ear infections, trauma, tumors, and Meniere's syndrome can act as causes. Causes outside the ear involve systemic causes, that is, cardiovascular causes involving hypertension primarily, neurological causes, metabolic causes, anemia, and ophthalmic causes. Non-infective causes involve height, spinning movements, and its change in sudden flow texture. Functional causes, which are generally of an unknown origin, may act as an important component in vertigo. Talking about the investigations for vertigo, we have four major categories, that is examination, tests, radiology, and pathological investigations. Certain other investigations are also used to detect vertigo, which will be discussed further. So, starting with the examination part. First and foremost, the patient should be treated symptomatically of the vertigo. Once the patient is relieved of vertigo and becomes comfortable, examination can be proceeded. Now, the examination involves three major things, that is history taking, otoscopy, and others. So, in history taking, a precise history regarding giddiness, deafness, tinnitus, and otorrhea is very essential, which may lead us to the causes of vertigo. Past history of injury, hypertension, and giddiness also plays a very important role. Otoscopy, that is examination of the ear, should be carried out very carefully in such cases. Other things which involve are blood pressure measurement, cardiovascular system examination, central nervous system examination, coordination of the gait, and corneal reflexes involves examination component. Rombox test, which is one of the most important tests which we perform to detect vertigo. What does it involve? So, Rombox test is an examination of neurological function for balance. So, the person who has a problem with either proprioception can still maintain the balance by using the vestibular function and vision. But if any two of these, that is proprioception, vision, and vestibular function is involved or affected, vertigo can occur. So, what happens over here? The patient is asked to stand erect with feet together and eyes closed. What are we supposed to do? We are supposed to stand close by as a precaution in order to stop the person from falling over and hurting himself. We are supposed to watch the movement of the body in relation to a perpendicular object behind the subject, which can either be the corner of the room or door, etc. A positive sign is noted when swaying, sometimes irregular swaying and even toppling over occurs. So the essential features of the test is the subject stands with feet together, eyes open and hands by the sides. The subject closes the eyes while the examiner observes for a full minute. Now, patients with positive result are said to demonstrate Romberg sign or Rombergism. They can also be described as Rombox positive. The basis of this test is that the balance comes from the combination of several neurological systems, that is proprioception, vestibular input, and vision. If any two of these systems are working, the person should be able to demonstrate a fair degree of balance. The key to the test is that the vision is taken away by asking the patient to close their eyes. This leaves only two of the three systems remaining, and if there is a vestibular disorder, that is labyrinthine disorder, the patient will become much more unbalanced. Now, talking about the tests for ear functions, we have two major categories, that is test for hearing and labyrinthine test. So, starting with the test for hearing, the first and foremost thing is the speech test. So, what is a speech test? It is the measurement of the acuity of hearing through generation of tones of known frequencies and amplitudes. Speech audiometry has become a fundamental tool in hearing loss assessment. In conjunction with pure audiometry, it can aid in determining the degree and type of hearing loss. The next we have tuning fork tests, which involves the component of tuning fork to differentiate between conductive and sensory neural hearing loss. So the first tuning fork test is a Weber's test, which was proposed by Ernest Henrik Weber. It is a test for lateralization. Over here, the vibrating tuning fork is placed in the middle of the forehead or on the vertex as shown in the picture, and the patient is asked that in which ear the sound is heard. In normal circumstances, the sound should be heard equally in both the ears. But if the sound is lateralized to the worst ear, it is said to be a conductive hearing loss. And if it is lateralized to the better one, it is a sensory neural loss. Talking about the next test, that is Rhine's test. Rhine's test was proposed by Hendrik Adolf Rhine. Air conduction is compared with bone conduction over here. The base of the vibrating tuning fork is placed firmly over the mastoid process of the patient. The patient is asked to indicate when the sound disappears. Suddenly, the tuning fork is placed vertically 2 centimeters from the ear. If here still then the Rhine's test is said to be positive in normal cases. The next thing, which is the most common thing, is audiometry. The audiometry examination tests tell us how well our hearing functions are. It tests both the intensity and the tone of the sounds, balance issues, and other issues related to the function of the inner ear. Talking about the second category, that is labyrinthine tests. It involves caloric test, that is thermal stimulation, which may cause nystagmus and sensation of rotation. The other test is electronystagmography, which is used to evaluate the people with vertigo and certain other disorders that affect hearing and vision. The electrodes are placed at locations above and below the eye to record the electrical activity as shown in the figure. By measuring the changes in the electrical fields within the eye, ENG can detect nystagmus in response to various stimuli. If nystagmus does not occur on stimulation, a problem may exist within the ear, nerves that supply the ear, or certain parts of the brain. Talking about radiological examination, we have a very particular X-ray which shows Townes view, that is transorbital anteroposterior view of the skull, which compares the internal auditory meatai of both the ears. Then we move ahead to pathological investigations, which involves hemogram, blood sugar levels, thyroid function tests. Other tests involve our ECG, CT scan, and MRI. So, talking about the scope of homeopathy, we have a very good scope for vertigo. The symptoms can be managed very well with our medicines. The management of etiology of hypertension, anemia, etc., along with the homeopathic treatment, can prove quite effective. Thank you.